Welcome to the Policy Visibility Drive, a Ghana Health Service policy initiative created to enhance the exposure of policies, manuals and guidelines within the health sector. In this video, we shall be focusing on the framework for the Ghana Health Service Excellence Award Scheme. The Ghana Health Service is the largest agency of the Ministry of Health, responsible for providing and prudently managing comprehensive and accessible health services with emphasis on primary health care. Our vision in the pursuit of this mandate is to have a healthy population that has universal access to quality health services. In our quest to improve on our performance and accelerate our progress towards achieving universal health coverage, which is key to realizing our vision, the Ghana Health Service has instituted an award scheme for its staff and institutions. The Ghana Health Service Excellence Award Scheme was launched on the 19th of December 2022 to motivate, recognize, acknowledge, and reward individual health workers for their exceptional contributions, achievements, and performance in healthcare delivery at the various levels of service. The award scheme forms part of the broader staff welfare and performance management system of the Ghana Health Service to inspire health staff and facilities to give of their best to help improve and sustain the quality of healthcare in the country, as well as to create awareness on the contribution of health workers to improving health outcomes and socio-economic development of the country. This has been designed to be competitive, starting at the district level, with each district winners progressing to the regional level to compete with their counterpart winners from other districts within the region. The winners from each region shall similarly advance to the national level, where they shall compete for the national awards with their counterpart winners from other regions. For the purpose of the 2023 GHS Excellence Awards, the period under consideration shall be the year 2022. This framework provides a general overview of the awards, including information on the awards categories, the eligibility criteria, the evaluation panel, the assessment criteria, nominations and submissions, and the timeline for the awards at the various levels of service. The goal of the Ghana Health Service Excellence Award Scheme is to build a sense of national pride, patriotism, and professionalism in health workers working under impoverished and stressful working environments. The objectives are: 1. To recognize outstanding performance of individual staff and health facilities in healthcare delivery. 2. To motivate health workers at all levels of service to perform at their best. 3. To promote excellence, that is, professionalism, innovation, good governance, efficiency, and best practices in healthcare delivery. 4. To improve and sustain quality healthcare delivery in Ghana. 5. To encourage high patronage of services provided by the Ghana Health Service. 6. To foster strong partnership and collaboration with stakeholders to enhance participation in healthcare delivery. 7. To enhance the image of the Ghana Health Service. The award scheme shall be guided by the following principles: transparency, sustainability, equity, and public ownership. Award categories. The award scheme comprises 3 broad categories as follows: individual staff awards, service or institutional level awards, and the special awards. The individual awards consist of 2 subcategories of awards as follows: the general staff awards, where staff at each level of service from community to national level shall be assessed on their performance, innovation, customer care, and work setting. Leadership Excellence Awards. Here, managers shall be assessed on their performance, innovation, customer care, stakeholder engagement, work setting, and sustained leadership. Both General Staff and Leadership Excellence Awards shall begin at a district level, with each district's winners progressing to the regional level to compete with their counterpart winners from other districts within the region. The winners from each region shall similarly advance to the national level, where they shall compete for the national awards with their counterpart winners from other regions. Evaluation panel. At the district, regional, and national levels, the evaluation panel shall consist of 5 or 7 members and can be selected from representatives of the various authorities and stakeholders at each level, such as the local assembly, traditional authority, private sector, health management teams, regional coordinating council, GHS Council, Ministry of Health, partners, and the media. In cases where the proposed panel members are not readily available, the regional health director or the district health director of that particular region or district can find a suitable substitute or replacement to join the panel. Eligibility criteria for general staff awards. 1. The nominee should be an employee of the Ghana Health Service, a staff not directly employed by the service who may be seconded or transferred to the service, or one who is working in a facility recognized by the service and is providing services in accordance with the GHS-approved guidelines. 2. The nominee must have completed their probation period. 3. The nominee must have not had any adverse reports on their performance or conduct within the past 3 years. 4. The nominee must have not been granted leave of absence, that is, study leave or leave without pay, within the period under consideration. For the Leadership Excellence Awards, in addition to the above stated eligibility criteria, the nominee must be a head of a facility, directorate, or division. If you've liked this video so far, please give it a thumbs up and subscribe to the official YouTube channel of the Ghana Health Service. Comment down below to let us know what you think, and click the card above to watch all Policy Visibility Drive videos. Nomination and submission process. Staff can be nominated by their colleagues, former colleagues, supervisors, community members, or any other staff of the service who is not a member of the awards committee. One nominator and one endorser are required for each nomination submitted for eligibility consideration. Each nomination must indicate the category of award selected. An individual may serve as a nominator or endorser for a maximum of 3 nominations. The Office of the District Director of Health Services shall receive, collate and vet the completed forms for nominees for the district-level awards. The compiled nomination forms received by the Office of the DDHS shall be duly evaluated by the panel, and the winners shall be selected at the district level. The winners for the district-level awards shall advance to the regional level to compete for the regional awards against their counterparts winners from other districts within the region. There shall be no new nominations at the regional level for these winners, who shall progress from the district to the region. However, their nomination form shall be sent from the district to the region for second-level evaluation against their counterpart winners from other districts in order to determine the regional level winners for the most outstanding staff or leader. The above steps shall be repeated at the regional level for the winners to advance to the national level to compete for the national awards against their counterpart winners from other regions. Similar to the regional level, there shall be no new nominations at the national level from these winners who shall progress from the region. However, their nomination form shall be sent from the regions to the national level for third-level evaluation against their counterpart winners in order to determine the national level winners among them for the most outstanding staff or leader. Please note, nominations for district and regional level awards shall be opened on 13th January 2023 and end by close of business of 10th February 2023, after which there shall be an evaluation of nominees, selection of deserving staff and facilities, as well as acknowledgement and presentation of awards. Nomination forms for individual awards comprise the following sections. 1. Service level of nominee. 2. Nominee's information. 3. Nominator's information. 4. Endorser's information. 5. Reasons for nomination. Service or institutional level awards. The service or institutional awards consist of the following subcategories at all levels of service: Best Performing CHIPS, Best Performing Health Center, Best Performing Primary Level Hospital, Best Performing Secondary Level Hospital, Best Performing District, and the Best Performing Region. Similar to the individual awards, the service or institutional award shall begin at the district level, with each district's winners progressing up to the regional level to compete with their counterpart facilities or directorates from other districts within the region. The winners from each region shall similarly advance to the national level where they shall compete for the national awards with their counterparts from other regions. Each category for the service or institutional awards shall be assessed for the selection of the awards using a combination of DIMS2 data, holistic assessment reports, and peer review reports. Special awards. The special award shall consist of the following: DG Special Award, GHS Council Special Award, Good Life Special Award, and the Hall of Fame Award. Please find on your screen an aggregate of all awardees at the various levels of service. Kindly note that nomination forms are free and available at the district and regional health directorates. You can also download the forms at the Ghana Health Services official website at www.ghs.gov.gh. Using the menu button, click on the GHS Excellence Award under Media Center. Print and submit the completed forms at the nominees' district or regional health directorate. We hope to count on your support and cooperation to make the Ghana Health Service Excellence Award Scheme successful and celebrate our health heroes, our lifeline. Please note, this video only contains an abridged version of the policy document or publication. To access the full document or for further reading, kindly visit the Ghana Health Services official website at www.ghs.gov.gh. Thank you for your time and attention.